Epilepsy is that kind of disease where people look normal and feel normal until all of a sudden they have this tremendous onset of this completely damaging event.
The Seton Comprehensive Epilepsy Program is truly an epilepsy center where many different physicians with different subspecialty training and expertise come together working as a team to offer comprehensive care for each individual patient. And we have epileptologists, neurosurgeons, and neuroradiologists, neuropsychologists, and psychiatrists working together to basically help patients from different aspects of their care.
So when I get a patient referred to me that's either just had their first seizure or they need to be on medications, I want them to understand it's lifelong, and what we need to do is find a medication. They don't need to live with side effects. That's one of the advantages of our great medications. We have up to like 25 drugs now, different epilepsy drugs that people can be on, and to say one works any better than the other is not the case. A lot of it is what's the tolerability.
What I'm doing is really managing any kind of psychiatric symptom that either predated epilepsy, was sort of occurred because of epilepsy, or some combination of the two.
We try to find out how epilepsy has affected an individual. Epilepsy can affect things like memory, language processes, reasoning, personality. So by going through in a systematic way and measuring these abilities, it can tell us a lot about the epilepsy.
When we're looking at phase 1, we're admitting someone into our epilepsy monitoring unit for a very specific purpose, and that is to capture seizures, to see where those seizures localize to.
The neurologists work them up in the epilepsy monitoring unit, and then we try to narrow down where the seizures are coming from. Once we have a fairly good idea where they're coming from, then we can take them to the operating room, and if the MRI shows a structural lesion, we can remove it. Or if there's still some doubt, then we can implant grids and electrodes and narrow the focus down even further, and then do the surgery.
However, there's a number of adult patients which require more non-traditional procedures. One of those is a procedure called hemispherectomy, which is where we actually either remove or disconnect the complete half of the brain. The good thing about that is that that has the highest chance of success. It's about an 85 to 90% chance of becoming seizure-free.
I think people need to realize is epilepsy is very treatable. People with epilepsy can have and should have normal lives, and they shouldn't settle for anything less.